Hello students, today we will discuss about the anatomy of paranasal sinuses. Now when you will see the paranasal sinuses are present in the certain bones of the skull. That means you have multiple bones in the skull, but all the bones does not have the paranasal sinuses. Paranasal sinuses are the air-filled spaces, so these bones form the boundaries of the nasal cavity and are having the air-filled spaces. So what is the characteristic of the bones? Those are having the paranasal sinus. That means these bones are forming the boundary of your nasal cavity. So in this diagram you can appreciate that this is your nasal cavity and you have the bones all around the nasal cavity like your maxillary bone, like your frontal bone, like your ethmoid bone, which are having the paranasal sinuses. Clear? Now, what are the features of paranasal sinus? Whenever you are having any paranasal sinus, you will find these common features. The first feature is that the cavity of paranasal sinus communicates by a small opening or ostia with the nasal cavity. Second thing is that all the paranasal sinuses lined by the respiratory mucous membrane. It is a ciliated mucous membrane and the gland produces a film of mucus which is moved by a cilia movement towards the ostium. The region of the ostium is relatively most sensitive part of any paranasal sinus, and all the paranasal sinuses are supplied by one branch or any branch of trigeminal nerve. You know that trigeminal nerve is having the three division: ophthalmic, maxillary and mandibular. So the paranasal sinuses are having the sensory supply from any of the branch from trigeminal nerve. Then what are the functions of paranasal sinuses? So the first function is that they are responsible for warming and humidifying the air which you are having during the inspiration. So the inspired air is going to be warmed and humidified by the paranasal sinuses. Second, they allow the enlargement of the local areas of the skull and they determine the position of the eyes and nose. Then it minimizes the weight of your skull. How? That they are minimizing the corresponding increasing of the bone mass. So they are making the skull lighter and they add some resonance to the voice. So these are the common functions of your paranasal sinuses. Now what are the names of these paranasal sinuses? So paranasal sinuses are bilateral. So this is the first thing which you have to understand. That means you will find the paranasal sinus on both the line of the your midline of the body. They are four in number. One is the frontal sinus, sphenoidal, maxillary and ethmoidal paranasal sinuses. The maxillary and ethmoidal sinuses are beside the lateral wall of the nose. So when you will see this diagram, what you are able to understand that this is your maxillary sinus and this is your ethmoidal sinus. So these two sinuses are just adjacent to the lateral wall of the nose. But when you will see the frontal and sphenoidal, frontal lies above and the sphenoidal is also above but on the posterior aspect. So what is the important thing to understand about these paranasal sinuses? That the location of paranasal sinus is all around the nasal cavity. So the maxillary sinus and ethmoidal sinus are lateral wall, but you will have the frontal and sphenoidal in the upper part of the nose. Now what is the development of these sinuses? The paranasal sinus develop as a outgrowth from the nasal cavities and erode into the surrounding bones. Clear? At birth, now this is the question of your exam, that when you will have the paranasal sinuses at birth, the ethmoidal and maxillary sinuses are present, but the frontal and the sphenoid sinuses are absent. So this is a very frequently asked question in your exam, that which of the following sinuses are present at birth. If you are having the option, then you always go with the maxillary sinus as a first answer. So maxillary sinus is the first choice which is present at birth, and the frontal sinus and the sphenoidal air sinus, these both are absent at the time of birth. The frontal sinus is last to develop and develop around 2 years of age. Now this is again the question of your exam, that which is the last sinus to develop Answer is frontal sinus, and it is start to appear at the 2 year of age. The maxillary sinus, it is first to develop and it is first to be radiologically visible at the age of 4th or 5th month of the life. So, there are few questions in this slide for your exam. First question is that which sinuses appear first at the time of birth? Answer is maxillary sinus. Which sinuses are absent at birth? Answer is sphenoid and frontal sinus. At what age frontal sinus appears? Answer is 2nd year. And which is the first sinus which radiologically appear? Answer is again the maxillary sinus at around 5th month of the life. Now, what about the frontal sinus? So, now we will discuss each and every sinus in detail. So, when you will see the frontal sinus as we have already discussed that they are bilateral, that means they all are present in a pair. So, these sinuses are one on each side of your skull. Now, they are variable in the size. So, this is the important thing, that whenever you are reading the sinuses, you have to keep in mind that sinuses are not of the equal size on both the sides. They are variable in size and they are most superior sinuses. So, I told you that they lies above your nose. So, they are superiorly placed, and the frontal sinuses are the only sinus which are not present at birth. So, this is again the important question, that which of the sinuses are absent at the birth and which are present. So, frontal sinus particularly not present at birth, it appears at the 2 year of age. So, they appear during the 2nd year of the life, and when you will see the position, it lies between the outer and inner table of frontal bone. Now, what is the meaning of outer and inner table of frontal bone? Now, in this section, what you are able to understand, that this is your inner table, this is outer table. Now, in between these two plates of the bone, you can see there is a tissue, and this is known as diploid. What is that? This area, this tissue is known as diploid. Now, this is later on replaced by the air-filled cavity, and this air-filled area or space is known as sinus. So, you will realize that this area is not present at birth, but later on there is a formation by eroding the tissue, that is the vascular tissue between the outer table of the bone and the inner table of the bone, and this is known as the sinus. Clear? The two sinuses are unequal and are separated by a bony septum in the midline region, and each sinus may be further divided into a number of small recesses which are communicating with each other. So, when you will see this diagram, in this diagram you can see that there are two sinus, one is on the right and left side, and these sinuses are separated by a septum, and these sinus are further divided into the small recesses which you can appreciate in the radiological appearance of the frontal sinus. So, when you will have the frontal sinus, you have to understand that they are not of the equal size and they are divided by a midline, and the another important thing is that frontal sinus are absent at birth. Now, the paired frontal sinuses are posterior to the superciliary arch. Now, here in this diagram you can see that where is the superciliary arch. So, superciliary arch is this portion. So, when you will have the superciliary arch or it is having the supraorbital margin, the frontal sinus is located behind this medial part of the superciliary arches. Now, each sinus usually underlies a triangular area. Now, when you will see the area, it is triangular in the shape, and how you have to locate or you have to mark the sinus here, for that there are 3 points which you have to understand. So, when you are making a triangle, you can see that this is a triangle. So, the first point is at the nasion, second point is 3 centimeter above the nasion. So, this is 3 centimeter above the nasion, and third point is at the junction of the medial 1/3 and lateral 2/3 of your supraorbital margin or superciliary arch. Now, if you will join these three, you are able to make the position of your frontal sinus. So, whenever you are having the frontal sinus, you have to understand that on the face, it is having the triangular appearance. You cannot see the posterior extension right now because it is a 2 dimension, But here you can see the triangle, there are 3 points, one is at the nasion, one is around 3 centimeter above, and one is at the junction of the medial 1/3 and the lateral 2/3 of supraorbital margin. Now, what are the important relations of the frontal sinus? Now, when you will see the relation, it extends above the medial end of the eyebrow into the squamous part of the frontal bone. Now, here you can see that this is your squamous part of the frontal bone. Now, in this squamous part, you are able to appreciate this cavity, and this cavity is the frontal sinus. Now, this frontal sinus is extend into the medial side of the eyebrow that we have already seen, and this is your squamous part of the frontal bone. Now, the backward extension. Now, when you will see the backward extension, it is going to extend into the orbital plate, and you know that orbital plate is going to form the roof of the orbit. Now, in this diagram, you can see that this bulge area. Now, this bulge area is nothing but it is the posterior extension of the frontal sinus, where you can see that this is the opening. So, this part, which is known as orbital plate of the frontal bone, and it is forming the roof of the orbit, is also containing the posterior extension of your frontal air sinus. So, the important relations are, first is the anterior cranial fossa and second is the orbit. Clear? Now, each frontal sinus drain through an ostium at its lower medial corner into the frontonasal duct. Now, in this diagram, you can see that this is the diagram of your ethmoid bone. Now, in this ethmoid bone, here you can see the opening. Now, this is the opening of your ostium, and this ostium will continue downward as a frontonasal duct. So, these are the opening, and these openings are present at the anterior part of your frontal sinus, but in the floor. Now, the frontonasal duct penetrates. Now, where is the frontonasal duct? This duct will start and it will go downward. So, it will penetrate the labyrinth of your ethmoid bone. So, it will penetrate the ethmoid labyrinth and it continue as the ethmoidal infundibulum. Now, in downward direction, when you will see, it will continue as a infundibulum, which further opens into the middle meatus, which is a feature of the lateral wall of the nose. So, it opens at the front end of the semilunar hiatus on the lateral wall of the nose in middle meatus. So, in this diagram, here you can see that this area is known as hiatus semilunaris, and the anterior part of the hiatus receives the frontonasal duct opening. So, here you can see that this is your frontal paranasal sinus, and from the frontal paranasal sinus there has to be a duct, and the duct is not visible here because this duct is actually passing through the bony labyrinth, which is a part of your ethmoid bone. Clear? Now, what is the nerve supply of frontal sinus? Frontal sinus is innervated by the supraorbital nerve, which is a branch of ophthalmic division of the trigeminal nerve. It receives the blood supply from the supraorbital artery and anterior ethmoidal artery. It drains into the superior ophthalmic vein, and its lymphatic drainage into the submandibular group of lymph nodes. Now, the next sinus is the maxillary paranasal sinus. Now, when you will see the maxillary sinus, it is again one on each side, and it is the largest paranasal sinus, and this is again the question of your exam. They completely fill the body of the maxilla. So, here you can see that these are the two large paranasal sinuses which are present in the body of your maxillary bone. They are also known as antrum of Highmore. Now, why they are known as antrum of Highmore? It is because of the positioning of their ostia or the draining point that we will discuss. Now, each of the maxillary sinus is pyramidal in shape, and the apex is directed laterally towards the zygomatic process of maxilla. Now, in this diagram, here you can appreciate that this is the base of this pyramid and this is the apex of the pyramid. Now, when you will see the positioning of this pyramid, this apex is facing laterally, and this is the zygomatic part of the maxilla, which is going to articulate with this zygomatic bone. So, this apex is present into the lateralmost part of the maxilla, which is known as zygomatic process of maxillary bone, while the base the base is present along the lateral wall of the nasal cavity. So, this is the base, this is the lateral wall. So, base is facing medially towards the lateral wall of the nose, while apex is facing laterally towards the zygomatic bone. Now, the maxillary sinus is present at birth, that we have already discussed, and initially it is just like a shallow slit, but beneath the medial side of the floor of orbit. So, when you will see the positioning of the maxillary sinus, it is definitely present below the floor of orbit, but initially it is just like a very shallow slit. The body of the neonatal maxilla lateral to this is full of the developing teeth. Now, this is the important thing to understand, that why the maxillary sinus is small into the newborn and why it enlarges with the age. The most common one of the reason is that you will realize that the cavity of the maxillary sinus is full of the developing teeth. Now, the sinus increases in the size after the second dentition. So, once the dentition will start, the sinus is now enlarges because the space is now become empty. So, this is seen around at the age of the 8th year. So, initially when you will see, the floor of the sinus is level with the floor of the nose. What does it mean? That when you will see the nose and on the lateral wall, there are presence of the two maxillary sinus. So, initially the floor of the nose and floor of the maxillary sinus is at the same level, but rapid growth of the sinus occurs after the puberty, and because of this the size will change, and in adult you will realize that the floor of the sinus will go down. So, this is the important thing to understand, that initially this floor of the maxillary sinus is at the same level of the nose. Now, what about the more things about the maxillary sinus, that when you will see the medial wall or the base of the maxillary sinus, it is facing towards the lateral wall of the nose. Now, when you will see this area, now this area is actually the medial part of the pyramid, because we have seen the lateral part of the pyramid facing towards the zygomatic bone and medial part is facing towards the lateral wall of the nose. Now, this part which is here is not visible as large as it is. Why? Because this part is closed by the surrounding bones. Now, what are the bones which are closing this part of your maxillary sinus? The first, the maxilla itself. Second, it is closed by the inferior concha. So, this is the inferior concha bone. Then it is posteriorly closed by the palatine bone. Here you can see this is the palatine bone, and it is closed by the your periosteum. Clear? So, they all overlie the maxillary hiatus and close this large medial base into a small opening. Clear? Now, the opening of the maxillary sinus is near the top of the base. Clear? Now, when you will see, it is at higher level and it opens in the posterior part of the semilunar hiatus, which grooves the lateral wall of the middle meatus. So, this is the middle meatus. In this middle meatus, you can see the groove, and this groove is known as hiatus semilunaris. In hiatus semilunaris, you can see in the posterior side there is a opening, and this opening is for the maxillary sinus. The ostium of the sinus is high up and well back on its lateral wall. That means on the nasal wall it is placed on the posterior side, and as compared to the floor it is at higher level. Now, in this diagram you can understand this concept that this is the floor of your maxillary sinus, but the opening is very high. So, that is why this is the problem, that maxillary sinusitis is very common, because whatever the secretions are present here, they are not drained properly because of the difference, and the difference of the draining channel is very high. And second thing is, because this will become highly dependent area under the effect of the gravity, and whatever the secretions are present, they accumulate into this part. So, that is why the maxillary sinusitis is common, and because of the positioning of its ostium, it is also known as high placed antrum or antrum of Highmore. Now, what are the important relations of maxillary sinus? The first relation is that the roof or the superolateral surface is related with the floor of your orbit. So, we have already discussed this part, that you have the sinus below the orbit. So this wall is making the floor of orbit and roof of maxillary sinus. So in this diagram, you can see that this is the roof of your maxillary sinus, which is forming the floor of this orbit. Second thing is the floor of sinus. Now the floor of sinus is the alveolar part, and this is actually here in the lower area, and this is the floor of the maxillary sinus. In this part you are having the number of teeth which are known as maxillary teeth, and then behind posteriorly it is related with the infratemporal and pterygopalatine fossa. So posteriorly in this area you will have the mainly pterygopalatine fossa. Anteriorly the sinus is related with the cheek, so this anterior part is known as cheek. Clear? So what are the relation? Upper part is having relation with the orbit, lower part is having the teeth and relation with the oral cavity. The posteriorly you will have pterygopalatine fossa, and anteriorly it is having the front of the face, cheek. Then what about the nerve supply? Now when you see the nerve supply, it is supplied by again the branches of the maxillary nerve, which is again a branch of trigeminal. Now here it found nerve supply comes from the infraorbital nerve, and it comes from the superior alveolar nerve. Now there are three superior alveolar nerve: anterior, middle and posterior superior alveolar. So all these four nerves, infraorbital and all the three superior alveolar nerve, are related with one of its wall. So how they are related? Now this is again the question of your exam. Now when you will see the infraorbital nerve, it travels in the roof. Now here you can see this is the roof, and in the roof you are having a nerve, and this nerve is the infraorbital nerve. Then you will have anterior superior alveolar nerve. Now this anterior superior alveolar nerve runs in the anterior wall, and in the anterior wall there is a bony canal, and that canal is known as canalis sinusus. So canalis sinusus is a bony canal in the anterior wall, and in this anterior wall this is your anterior superior alveolar nerve. Then you will have middle superior alveolar nerve. The middle superior alveolar nerve runs in the lateral wall, and you have posterior superior alveolar nerve that pierces the posterior wall, and then it will go to supply the upper teeth. But while they are supplying to the teeth, they are giving the minute branches, and these minute branches are entering inside the maxillary sinus to supply the mucosa of maxillary sinus. Now it receives the blood through the branches from infraorbital artery, superior alveolar artery, greater palatine artery, which all are the branches of maxillary artery. So here you can see that this is the maxillary artery, this is greater palatine artery, this is infraorbital artery, this is alveolar artery. So these arteries are going to supply the blood to the maxillary sinus. The lymphatic drainage, so it will drain into the submandibular group of lymph nodes. Now the next sinus comes is the ethmoidal sinus. Now when you will see the ethmoidal sinuses are lies between the orbit and the nose. So this is the first to understand where you will find the ethmoidal sinus. So this is your orbit, this is your nose, and in between you will have the ethmoidal air sinuses. Now these ethmoidal air sinuses is not a single cavity. It is not a single cavity, but there are multiple small pockets which are known as air cells, and they are divided by the bony septas. Clear? Each cluster of the cell is separated from the orbit by the thin orbital plate of your ethmoid bone, and that is so papery thin, that's why that plate is known as lamina paparacea. What is that? Lamina paparacea. So this is the question for your exam. What is lamina paparacea? It is a bony part of the ethmoid bone which separates the orbit from the ethmoidal air sinuses, and it is so thin like a paper, and it is known as lamina paparacea, and it also separates from the nasal cavity by the medial wall of the ethmoidal labyrinth. So in this diagram, if you will see where is the orbit, so this is the orbit. Now inside this orbit you can see the eyeball, and where is your nose? So this part is the nasal cavity. So this is your nasal cavity and this is your orbit. Now where you will find the lamina paparacea. So this bony plate is known as lamina paparacea because deep to the lamina paparacea, here you can appreciate the number of small pockets which are full of air. So these pockets are nothing but these are known as ethmoidal air sinuses. So ethmoidal air sinuses are located between the medial part of the orbit and lateral wall of the nose, and they are separated from the orbit by a bony plate, and this bony plate is known as lamina paparacea. The labyrinth does not have its own roof, but it is closed by the orbital plate of the frontal bone. What does it mean? That this is the roof of your ethmoidal air sinus, and this roof is not the part of your ethmoid. The ethmoid is not having the roof, but this roof is contributed by orbital plate of your frontal bone, because the orbital plate of frontal bone is going to make a joint here with the cribriform plate on the lateral margin. Clear? So in this diagram you are able to understand the position of the ethmoidal air sinuses and what is lamina paparacea. Now the ethmoid air cells are divided into the three groups. So you know that there are three ethmoidal air sinuses: anterior, middle and posterior, and their names are given on the basis of the location of their aperture for drainage on the lateral wall of the nose. So where their aperture is going to drain decide the position of these ethmoidal air sinuses. So first is anterior ethmoidal air cells. These anterior ethmoidal air cells open into the ethmoidal infundibulum or the frontonasal duct in the middle meatus. So where is the opening of anterior ethmoidal cell? Answer is in the middle meatus. Now when you will see the middle meatus, so this is the middle meatus. In this middle meatus there is a opening here, and this opening is for the anterior ethmoidal cells. Then you will have the middle ethmoidal cells. Now the middle ethmoidal cells are going to produce a projection, and that is known as ethmoidal bulla, and these middle cells will open on the bulla itself. Then you will have the third set is the posterior ethmoidal cells. Now these posterior ethmoidal air cells are going to open in the lateral wall in superior meatus. So where is the superior meatus? So this is the superior meatus where you will have the opening of your posterior ethmoidal air sinus. So when you will see the lateral wall of the nose, in the lateral wall there is a superior meatus which is having opening of your posterior ethmoidal sinus, and there is a middle meatus where on the ethmoidal bulla you are having the opening of your middle sinus, and in the anterior part of the infundibulum you are having the opening of anterior ethmoidal sinus. Now the ethmoidal sinuses are innervated by the anterior and posterior ethmoidal nerves. Now these anterior posterior ethmoidal nerves are the branches of nasociliary nerve, which is again the branch of ophthalmic division of your trigeminal nerve. Apart from that, the maxillary nerve also contribute to supply. So here you can see that the two divisions of trigeminal are supplying your ethmoidal air sinus. One is the ophthalmic division and second is the maxillary division. Maxillary division supply with the help of the orbital branches, and these orbital branches are coming from the pterygopalatine ganglia. Now because of the two source of the nerve supply, sometimes there is a referred pain is seen in the sinusitis of ethmoidal sinuses in the area supplied by these two nerves. Now the pair of the sphenoidal sinus occur in the body of your sphenoid bone. So when you will see the sphenoidal sinuses, where you will find the sphenoidal sinus, they are present in the body of sphenoid bone. Now the sphenoidal sinuses lies posterior to the upper part of nasal cavity. So when you will see the location of all these four sinuses, we have seen the maxillary sinus here on the lateral wall of the nose. You have seen the ethmoidal sinus again in the upper part of the lateral wall of nose, frontal sinus in the anterior part of the superior relation, and the sphenoidal sinus is again in the superior relation but in the posterior part. The two sinuses are separated by the septum, and because again whenever you are having any septum which dividing the sinus, both the sinus become unequal in the size. So that's why the both sinuses can vary in the size. The ostium, when you will see the opening of your sphenoidal sinus, it is present in the anterior wall of the sinus, which is 1 centimeter above the choana, and the opens into the spheno-ethmoidal recess. So this is the question of your exam. Now here in this diagram, you can see that this is your superior concha. Now above the superior concha, there is a recess. This recess is known as spheno-ethmoidal recess. Now in this recess, there is a opening, and this is the opening of your sphenoidal air sinus. So sphenoidal air sinus opens into the spheno-ethmoidal recess, and the opening is around 1 centimeter above the choana. Clear? So this is your superior concha or the choana, and the opening is around 1 centimeter above this level. Now this is the diagram of your sphenoid bone. Now in this sphenoid bone, you can see that this is the body of sphenoid bone, and in this body you will find on both the sides the air spaces which are known as sphenoidal air sinus. Clear? Now what are the important relations of sphenoidal air sinus? So above the pituitary, above you will have the pituitary fossa, and there is a relation of optic chiasma and middle cranial fossa. So it is very clearly understood that this is your pituitary fossa. Now above the pituitary fossa, you will have the optic chiasma, that is the crossing of optic nerve, and this is the area of middle cranial fossa. Now laterally, now this is the important question, that laterally there is a projection occurs in the sphenoidal air sinus. Now why the projection occurs? So sometimes you are having this question. Here you can see that this is the projection. Now this projection which is visible here is produced by the internal carotid artery. Clear? So what is the question, that why the projection is there, or you have the question that which underlying structure produces the projection or the bony ridge inside the sphenoidal air sinus? Answer is internal carotid artery, and it is also related with the cavernous sinus and the structure present in the cavernous sinus. So superior relation is important, that is the pituitary gland. Lateral relation is important, where you will have the bony ridge which is produced by underlying internal carotid artery, and it is also related with the cavernous sinus. Now in the front, now anteriorly, this is related with the your nasal cavity, and it is also related posteriorly with the posterior cranial fossa which will come here, and below it is related with the nasopharynx. Clear? So all around if you will see the relation, the anterior relation is the nasal cavity, inferiorly you will have the nasopharynx, posteriorly you will have posterior cranial fossa, above you will have the pituitary gland, and laterally you will have the cavernous sinus and internal carotid artery, and artery produces a bony ridge inside the sinus. Now what is the nerve supply of sphenoidal air sinus? It is supplied by the branches of first division and second division of trigeminal nerve. The ophthalmic nerve supplied through the posterior ethmoidal nerve, while the maxillary nerve supply through the orbital branches of pterygopalatine ganglia. It is receive the blood from the branches of pharyngeal arteries from the maxillary, and its lymph will go into the retropharyngeal group of lymph node. This is again the important question, because you have seen the remaining sinuses drain into the submandibular group, but the sphenoidal sinus drain into the retropharyngeal group of lymph nodes. So there is an important clinical relation of the sphenoid sinus, that because only the thin shell of the bone separates the sphenoid sinus from the nasal cavity below and hypophyseal fossa above. So here you can see that this is the small cavity. Now this small bony plate is separating this cavity from the sphenoidal sinus, and this one more bony plate separating the sphenoid sinus from the nasal cavity. So there are three spaces which you can see here. First space is the pituitary gland area, second is the sinus, and third is the nasal cavity. And there are two partitions, one is this thin plate and another is this thin plate. Now, the pituitary gland can surgically approach through the roof of nasal cavity. So, this is the roof of nasal cavity. Through this roof, you can approach the pituitary gland, and this approach is known as transnasal approach. This approach is known as transnasal approach of pituitary gland. For this, the scope is first going to pass through the nasal cavity, then you have to pass through the sphenoid bone, then into the sphenoid sinus, and then ultimately you will enter through your sphenoid bone into the pituitary gland. So, if you will pass a probe, first you will enter the probe inside the nasal cavity, locate this anterior wall, then puncture this anterior wall, pass through the sphenoidal sinus, then puncture this floor of the pituitary fossa, and you will enter or you will reach to the pituitary gland. So, this path is known as transnasal approach of pituitary gland. Clear? Now, this is the last session to understand that whenever you want to see the paranasal sinuses, we always go for the plane X-rays. Now, these plane X-ray will show the translucent areas of the paranasal sinus in respective bones. Now, here you can see that these are the translucent areas, but if you want to see all the paranasal sinuses in a single X-ray plane film, then you will take a special kind of the view, and that is known as Waters view. Now, in this X-ray, so many times you have the question, mark the different sinuses. So, where are the different sinuses? If you will see this X-ray, this is the first sinus where you can see the multiple translucent areas, and this is your frontal sinus. Then, this is your orbit. These are the orbits. Now, below the orbit, you will have the large maxillary sinus. So, these are the maxillary sinus. Clear? And these are the frontal sinus. Now, here this area is having the ethmoidal sinuses. Now, where is the sphenoidal sinus? Now, sphenoidal sinus is not very well visualized in the Waters view, but sometimes you have the question to mark the sphenoid sinus. Now, here for the sphenoidal sinus, you can see that this is your upper teeth line and this is your lower teeth line. Now, this is your hard palate. Now, above the hard palate, now here you can see this is the area of your sphenoid sinus. Why? Because I just told you that sphenoid sinus lies above the nasopharynx. So, in this view, you are able to see the roof of the nasopharynx, and through the wall of nasopharynx, you can see the small shadow of your sphenoidal sinus, which are not well illuminated, not well visualized in this view. But still, if you have the question, where is the presence of sphenoidal sinus? So, here you can see this is the frontal sinus, these are the ethmoidal sinus, this is your maxillary sinus, and this is your sphenoidal air sinuses. So, at the end of this class of paranasal sinus, we are able to understand what are the paranasal sinuses, what are the characteristics of paranasal sinuses, what are their function, and the most important thing is which sinuses are present at birth, which are developed later on, what are their anatomical important relations. So, this is all for today's class. Thank you.